Thank you so much for this opportunity to come and share our experience. And aloha from Hawaii. Um, there's a Hawaiian word and it's called mo'olelo, and it means story. And so how I want to present this today is share a journey through COVID here in Hawaii and through the Queen's Medical Center, and just kind of take you on a personal perspective through my eyes and our team of nurses and how we went through the process. You heard our current numbers, and the way we measure COVID here right now in the state is a rolling 7-day average. And our current 7-day rolling average is about 104 patients. And so we're just trying to measure to see what the community spread's going to be and what the impact's going to be to our medical center. Luckily, right now, we're in a kind of a very kind of a lull right now, waiting for that third surge. And as we go on through my presentation, you'll see that we've already gone through 2 surges and preparing for the next one. We are currently at our lowest census of little over in the mid-20s, with half of them being in the ICU and most of them on ventilators right now. And so again, we're just bracing for what's coming in the next few weeks to months. And Hawaii is nice. I mean, it's a vacation destination. Some of you have been here. We're blessed to have just beautiful mountains surrounded by oceans. And it's a definite remote area on the world stage. But we've seen our share of epidemics, smallpox, measles, flu, and COVID. And then let's go back and look historically. And again, from an epidemic standpoint, in 1778, with the arrival of Captain Cook, the Native Hawaiian population was a little over 300,000 people. And within about 60 to 80 years between disease, war, and famine, 75% of the Native Hawaiian population was decimated. And many of that was just due to diseases. Now, the Native Hawaiians at the time did not have an immunity to it. And so what happened is our population started dying. And it was really hard for the king and queen, who were the reigning monarchy. And they were a young king and queen. A little bit about Queen Emma and King Kamehameha IV, who founded the Queen's healthcare systems that they are right now. Traditionally, in some instances in Hawaiian culture, monarchy or people were adopted. And so a young Queen Emma was adopted by her auntie, and who was married to an English physician. And so at a very early age, Queen Emma was introduced to healthcare when she rounded with her father and taking care of sick people. And as she grew in age, she would visit people's homes, her family's homes, her community, people in her community, and she cared for them. And while she was not a nurse or a healthcare giver, she had a heart, compassion and love for them. And the young king and queen, who were not rich by any standard, really humbled themselves and went door to door to raise money because they saw their people dying due to diseases. And so a royal legacy was to stay the wasting hand that is destroying the Hawaiian people. And after going door to door and raising money, they laid the first cornerstone for Queen's Medical Center on May 24th, 1859. Halima'i o Kawahine Ali'i was the first building that would span what the Queen's Health Systems is right now. And so our mission is to honor them, right? And so the king and queen, the intent is to provide in perpetuity quality healthcare services and to improve the well-being of Native Hawaiians and all the people of Hawaii. And it was that introduction to healthcare by Queen Emma that really set forth our mission and is why we're here taking care of COVID patients in Hawaii. Now, our health system started with our punch bowl with 575 beds on the top left. It spans 4 hospitals over 3 islands. We have healthcare centers, island urgent care centers, and we have resources in Guam and Saipan. So we're a center of the Pacific, And so when COVID hit, not only Hawaii, but anywhere in the Pacific Basin, we are going to be that referral center. And so Punchbowl is the biggest, it's our flagship. We're the largest private hospital in Hawaii. We employ over 2,000 nurses at the bedside, managers, advanced practice nurses, over 1,400 physicians, and see over 20,000 patients of acute care admissions, as well as 400,000 outpatients. So we're basically at the epicenter of COVID. And because we are the largest hospital, we do get the lion's share number of patients. And as we can see, a pandemic or an epidemic that happened in our history, in our Hawaiian history, has set precedent and has laid that foundation for us to take care of COVID patients now. And we've heard our first speaker, Ms. White, talk about compassion, and these values really resonate, I'm sure, with each and every one of us as healthcare givers that provide care to our patients. Compassion guides our actions. Aloha inspires us in all that we do. Respect and understanding are essential for the dignity of all, and excellence is our quest. And like everyone here, it's all about teamwork and one team committed to provide the best patient care for our community. And as we saw opening up, nurses are at the heart of healthcare. We're at the bedside 24 hours a day, 7 days a week, 365 days of the year. And I'm happy to hear of your journey through your magnet. We've been magnet for a number of years, and I applaud you in your journey because it is really hard to get. But it just highlights everything that nurses do, the good things that we do at the bedside, the evidence-based practices that we provide, the high patient care outcomes, and most importantly, the two most important things is nursing satisfaction and patient satisfaction, which are core standards for us as being a magnet center and for you all too. So we're humming along. And about a year ago, right, COVID hits. And with the advent of social media, what we can see on TV, we saw it happening late in 2019 and happening in Wuhan in China, and it spreading across the globe to Europe, America, Africa, South America, where you guys are at. And we're scared, right? And so we're bracing for this. We're trying to prepare. We know it's coming. We see people dying. We hear the numbers. We see people in hazmat suits. How is it going to affect us here in Hawaii? And so a large team of us met, and it ranged upwards of about 80 people. So we got providers across all systems, across all service lines, nursing, physicians, and we tried to review what was happening in the world, what was happening in the United States on the East Coast, where COVID was surging and new cases were happening in the thousands per day, and locking down and trying to develop guidelines and protocols and doing our best so that when it hit our shores, we were going to be best prepared. And overall, our numbers aren't as bad as any other place. We were in the bottom third as far as rate of transmission. The number of deaths comparatively, at least in America, in the United States, have been low. But despite all that, this is really what our nurses and what we feel like, right? I don't want to get sick. I'm scared. Let's lock down Hawaii right away so we don't have any COVID here. And what if I take it home? You know, local culture here in Hawaii, it's not uncommon that 3 and maybe even 4 generations of family members live in the same household. So you got grandkids, you got yourself, you got your grandparents, and even in some places, great grandparents. And so ohana, or family, is really important for us in our local culture here. And so if I'm a healthcare giver, or our nurses were, or if they got COVID, they were scared of dying and getting sick, but more importantly, they were more afraid of getting their loved ones sick, their kids, and more importantly, because we know it affects the elderly, what is it going to happen, or what is it going to do to my parents if I give it to them? And so the whole thing with I don't want to die, I'm a cancer survivor, I don't have an immunity, were very well ingrained in our nurses and how they felt and how scared they were. And really, one of the biggest things we saw was hazmat suits on the videos, and do we have enough PPE, and do we have enough masks? And so one of the first things we did as a medical center and as a state working together with other hospitals was what could we do to make sure that we provided and or had enough supplies or PPE for our staff. And so with the advent of emergency use authorization for different disinfection systems like Xenex or cellulose-based masks, we started continually to work with our supply chain to purchase as many of you have done, as many supplies that you could get to prepare for the coming surges and to keep your staff safe. And then we also partnered with the state and the federal government because they received the EAU, the Battelle disinfection system using vaporized hydrogen peroxide to disinfect tens of thousands of masks per cycle. So because of that, our medical center leased a warehouse on the other side of the island where we could store our much needed supplies as well as have a base for this Battelle system. And again, like the king and queen and taking care of the whole community, the hospitals worked together with the federal government to put Battelle on the island and offered that service free to anybody that needed it in healthcare. So whether you're a dentist office, a private physician, or one of the many hospitals on Oahu, you could use that system to disinfect your mask to keep them safe. And again, along the journey with COVID, we've talked about and heard Cheryl talk about teamwork, and that's super important. And these are nursing directors that I work with, and we've gotten very close over the last year or so. And so we have different nursing directors who are very on the administrative side, understand what needs to go on behind the scenes, but also very aware of what the operational needs and understanding of our service lines and how to support our staff. And so we took our individual expertise in our individual service lines, and we put together an incident command team similar to a lot of disasters and FEMA training here in the United States. And we set up an incident command center. And so we each had our own different specialties and who we interacted with and with our team. So Jill was on the inpatient side. So on the inpatient, the clinical side, how were we going to place patients? Where were we going to place them? If we spilled over to different units, how were the units going to interact with each other? How were we going to get pharmacy involved, housekeeping, transportation, and all that belonged with Jill. And Greg was in charge of the emergency room. And so a lot of our patients, right, we set up tents outside of our emergency rooms. How do we triage them? And then Greg was also one of the directors for patient throughput. So how do we expeditiously get our patients from point A to point B? And as we start to downgrade them, how do we get them into the right bed at the right time so that we could provide the right services? And one word, Hawaiian word for that is kinaole, and it's providing that the right care for the right patient at the right time. And that's what we strive for here. And I know that's what you strive for at your healthcare centers. Dell on the right side is a director for the surgical services operating room. So she was in charge of screening patients for surgeries as well as testing. And I was a logistics guy. So I was a getter. If you needed masks, if you needed a room, we set up a hotline within 24 hours with computers, with staff, with telephone lines, because we knew that when the surge came, there were going to be community calls and we needed a method to field them. And then we also knew there'd be internal calls from our staff that wanted to know what to do, who could I call if I got sick, what do I need to do? And so that was my main job. Interestingly enough, because of COVID and everything that's going on, it really, and I'm sure it's happened in your medical centers too, it really brought people together and engaged teams that necessarily wouldn't have engaged together on a whole different level. And I'm sure like you, we were able to come up with innovative processes, improvements, worked on efficient protocols and guidelines. And I worked with my supply chain daily. And I know more about supply chain than I thought I ever would in my entire life. And then, I got to work with amazing people to get supplies to our patients, actually to our staff who really needed it. And like we heard Cheryl and a number of the speakers earlier say, it does take teamwork to make the dream work. And in the upper left-hand corner, you see kind of that's our first surge. And we've already went through 2 surges here in Hawaii. And our first surge started with 2 units, our medical ICU, which had 19 beds, and a medical surgical respiratory unit, which I had the rest of those beds. And I remember when we started to build the teams, it was really important to make sure that, like we heard, like rounding is to make sure that we take care of their well-being and quell their fears. And so we rounded a lot, and we made sure we answered their questions. And if we didn't have the answers, then we went ahead and got those answers and got back to them very quickly. Because we know that, fear of the unknown can really set the mind off and can really take you to places that you really don't want to be. And when we're taking care of our patients, we want to make sure we provide the best care. So providing that support for our nurses and our clinical staff in a meaningful way so that they could be resilient, that they could have hope, that they could be compassionate and empathetic despite everything that's going on in the world, and the fear of bringing COVID home to their families was at a minimal. I remember walking around to a couple of my units. One was in a CCU, in a cardiac ICU, and one young ICU nurse, brilliant nurse, very smart and very good at what he does in taking care of patients, came up to me with an iPhone and showed me, and there was a little crack in his voice and you could sense he was scared, and he was asking for hazmat suits because he showed me a video of the care of COVID in China, and he was really scared. And so I had to talk him through that. And walking through the medical ICU when they started taking care of COVID patients, their team really stepped up, amazing nurses in the intensive care. And I'm sure you have many stories you could share about your teams really pulling together. And while we walked through the unit and talked story and shared some of the experiences, she had some confidence in saying, hey, you know what, Kapuna, it is getting better. We got a system, we got our proning team to turn our patients, and move our patients from side to side and over and proning them. And we know that, we coordinate all our care so that we minimize the number of times we have to get into those rooms. And she seemed excited about it, but you could still feel that little bit of a hesitation of being a little scared because of, and I said, how do you really feel? Are you still scared? And she said, yes, I am. I'm scared to take it home because my dad's older at home and he's a little sick, and I don't want him to die. And so despite having these ups of, having really good experiences and coming together as a team, there's still that little bit of fear that permeates in all of us when we're taking care of somebody and getting sick. Our med-surg tele units really stepped up, and they became a model. So their fear and experience for taking care of COVID patients actually helped to serve other patients and other departments as we went along in our journey. So one of the things they wanted to do was communicate. How are we going to communicate with each other and with our patients? Because the more times I go in the room, the more chances I'm going to get COVID. And so we use a normal system with a call system. We use innovative ways like low tech as far as writing on windows and passing messages through pieces of paper. And also integrating and using our translating device called Marty. So originally that was meant to help translate for different languages when we're explaining healthcare, and we use that as a healthcare device, among other things. And so the lockdown happened, and what you see on the bottom of your screen is really the 2 surges that happened in Hawaii. So in early March and spring, our first surge happened, and it spanned roughly about a month or so. And we peaked out at having roughly about 20 to 25 inpatients. And so when we saw the surge coming from the different parts of the world and the United States, it was about a lockdown. So what you see on the left is what a typical pre-COVID day would have been in Hawaii on the beach. And what you see on the right is what it looked like in the lockdown. There was nobody. And so when we looked at the surge and we locked everything down in the state, and we actually curtailed and cut services on the first surge to prepare for the deluge of patients that would come in. We realized that we didn't necessarily need to turn off all of our services and our operating rooms to only urgent and emergent. And so we realized during the first surge, we were able to mostly manage most of our patients within those 2 units, and then spilling over some of our COVID patients into specialty units like our CCU, ECMO patients, and then our acute neuro patients. And we had a little period of what you see in a number of months of not a lot of COVID patients in the community. And as we started to open up again, we saw that second wave that started in July that lasted up until September. And in which case, excuse me, we had maybe mid-20s of patients in our hospital that went up, and we peaked of 130 patients. And so this is about nursing and how do we keep our nurses resilient? How do we keep them meaningful and focused? And this is a Hawaiian word. It comes from 2 words, ola, meaning life, and kino, meaning body. And so how do we help our staff keep that state of health and well-being at its highest? And again, as the staff had mentioned, how do we going to communicate with each other? Was really how are we going to keep communication flowing from the state to their level? How do we keep things get updated about guidelines and changes in protocol and PPE? And we created weekly updates with emails. Really quickly, we created a website that they could go to for all of their questions and needs and protocols about COVID. And we created a website fairly quickly and about mandatory symptom checks and messages from our leadership, ongoing communication. We created dashboards, how many patients are in the house, how many have COVID, how many in the ICU, how many are not in the ICU, how many are infected, how many masks do we have, are we red, yellow, or green state with the amount of supplies that we have, and then how many patients do we have at our different sites. And if you look at the bubble chart with the islands, where are the hot spots in the islands? And they were asking and almost demanded this kind of information. And we found that by creating this dashboard and creating that air of transparency really helped to connect the team and administration and the state to quell a lot of those fears that people had. And so that the more information that they had access to and they had, the more calm and more alleviated they felt. On the dashboard, we had our rolling 7-day averages for the state in cases, which was very important to decide where we would move. We had a hospital matrix that said, where we have visitors, will we turn off visitors? Are we going to have procedures, or are we going to cut down procedures based on community prevalence and census in the hospital? And in that upper left-hand corner, you see a lot of, along our surge, different times where different indexes of situations happened. When did we close down? When did we open up tourism, which has been about 3 weeks now. And we know that people who got COVID started showing signs and symptoms between 6 and 10 days or so. And if they got sick, would come in 2 weeks. And we saw that pretty much on the spot in the medical center, that any big major event that happened that could potentially cause that spread, we saw that increase about 2 weeks later. We provided resources, so opening strategies for the state. We provided the staff with that. One thing that we thought actually was really good for the staff that they really engaged and participated in was having a town hall. So every Thursday, today's Thanksgiving, so we ended up canceling it today, but every Thursday at 3 o'clock Hawaiian time, we had an hour-long COVID town hall, and where we had gave the staff the opportunity to ask questions, to submit them via the website, and we'd pull them and we'd have a panel and we'd answer their questions. And we've done this for a number of months now. We started out with maybe low 200 participation, and we're upwards of a solid 400, 500 participation rate with these town halls. And it's just a great, active, engaging way to connect with our staff. We had our camera team, our videography team, go out and video and video people, our staff. How are they feeling? What's good happening? What's going on in your unit? How are you taking care of patients? And having these video testimonies on the websites really created another means of connectedness to each other, which was really important because it was their peers speaking to each other and sharing their COVID experience. it's some way that, you know, we as administrators can talk and run with our staff, and I think it's super important. But it carries so much more weight when the peers talk to each other and figure those things out and be able to share. You know, we had the opportunity to work through setting up different critical care areas, and we heard a number of speakers talk about training, up-training med-surg nurses into tele and tele into ICU to critical care, and we did the same things with that. We made sure we had enough ICUs that we could, and during working with our data teams to project how many ICU patients and how many patients would come in, and we developed a lot of different surge plans in order to accommodate as more patients came in. But one thing we're very proud of is the creation of our new infectious disease unit. And like the King and Queen did, it's really about connecting with our community and with our partners, because we realize that we can't do everything ourselves. And so we worked with our community leaders in our community, and they donated to be partners with our new infectious disease unit. And we're really happy. It was all hands on deck in order to get this unit up and running. And we expanded that first unit that we talked about in Queen Amatara, 9 Diamond Head, that respiratory floor. And now it has 48 beds, and it's a state of the art. It has disinfection UV light in each and every room to maximize and to minimize transmission and the maximize the turnover time it takes to take patients in and out. We have telehealth monitors with speakers and TVs at the foot of the bed and the walls for our patients so that they feel connected. And I realized that, you know, one of my fears is actually being in the hospital and being sick alone. And I think many of you have realized that when the surge came, we shut down visitors, and it was very lonely to be a patient while you were in COVID. And so it was important to be connected, not only with your family through telehealth and telemedicine, but also to be connected with the nursing staff. And like many of you guys out there, it's all about appreciation, being connected with our staff. And so we have mahalo meals, thank you meals that we give out to the staff frequently. There's a lot of videos coming from the senior leaders, Jill Green and Jason Chang, who are leaders at our medical center to say thank you, to thank our staff. One of the things we did, again, because we're a small community and we're multi-generational, was we knew that people would start losing jobs or losing work. And the first thing our senior leaders did at the medical center here was protect our pay for 2 months, which was very huge for our staff. So it allowed them to have respite and not have to worry about not losing their jobs or paying, but really focusing on patients. And Hotels for Heroes. So we partnered with the hotels so that if some of our patients, some of our families got sick at home, our hotel workers could go there and be able to have a safe place to sleep and find respite before they have to come back. Staff wanted mass testing, so we created a testing program, and we created an app with a local data house to check in with our sign-in system to say, are you okay and safe to come into work? And we heard about resilience and then about having hope, and hope turns into action, and how we can turn that action into helping each other and building the team. And we had Schwartz rounds, and meditation rounds. The Schwartz rounds were important, and if you haven't instituted this in your medical center, I would highly encourage it. It's really about having a safe space for caregivers to share their feelings and to connect with other people that aren't within their small sphere of friends. And how do we celebrate moments worth preserving? Happy birthday, despite all the fears and the death and the dying that's happening. How do we share brightness in the world? It's important because if we feel bad, our patients will feel it, and we can't be ourselves to get through this pandemic right now, and the fear of the unknown. And other ways we supported, we worked with our federal government to provide federal relief nurses, so they came in and helped. And again, Hawaii is all about ohana. It's about family. It's about being connected. And as you can see, these are all pre-COVID pictures, but that smile and aloha is really, really what permeates and really what fuels the engine that drives us to do the care that we do. And I know it's embedded in each and every one of us as nurses. And as our rate of transmission goes down, from I'm being scared to we can do this, to we have to be positive, I have hope. And one of the nurses on the video program had said, you know, you just have to stay calm. You have your PPE, and you are safe. And so as we come up with the holiday season and our season of gratitude, and just honestly, I think there's a lot that COVID has done. It has showed us to live and think differently. It has showed us that we can provide care differently, more efficiently, more innovatively, and we can work together to overcome anything. We will get through this. And my challenge to all of us and all of you as we come up in the holiday season, how's we gonna pay that forward? How are we gonna share those blessings that we have and that we feel that are in with us, our compassion and aloha? How are we gonna spread that to our patients, and more importantly, to each other outside of work each and every day? And so we share those moments. This is on the left in the ICU on a patient where we had no visitors. It was his birthday. And so it's these little moments of compassion and aloha that we're able to share with our patients to make them, you know, a shaka sign. It's like they're that smile. And those nurses and our healthcare givers, that's what's in us, and that's what we can impart into our patients, because we know that love and aloha are inseparable to the healing process. And like Cheryl shared I'll share just a quick video. Mr. Noah was a 45-year-old construction worker from Hawaii who contracted COVID when he went to Vegas for a conference and conducted COVID.
After 7 weeks,
I'll share this video with you.
Last resort treatment for COVID-19, and Ella Beachman is finally home in his own bed. Ben Gutierrez spoke with a doctor who recommended the life-saving treatment.
I just want to share with you. You saw that clapping, and that really goes to show that despite that patient, Mr. Noah, being on ECMO and, you know, having his heart stop and us doing CPR on him, that he left the hospital. And those claps that you saw from the staff and the doctors are in us. And that's what drives us to do what we do. That's what drives us to put us in harm's way as nurses at the bedside 24/7, 365. It's those little moments of caring and seeing that we've helped to get someone along that journey from being sick into wellness is what drives us. And so I'll leave you with these two quotes from our king and queen. We on our parts must not forget to show loving kindness in all ways. And the king said, but let me remind you that so long as sickness shall exist, there will be a duty imposed on us. And I know the duty and the kuleana, or the responsibility that we as nurses at the bedside, or as we as administrators impart, it's our duty to take care of our nurses, ourselves, and our community. And we do that with loving kindness and aloha and compassion and respect and excellence. Mahalo nui loa. Thank you very much for allowing me to share this with you. And I hope you have a wonderful holiday season and happy Thanksgiving. Aloha and mahalo.